Sir, namaste. Thank you so much for coming to DHEE Hospitals and being a speaker for our CME for our laboratory technicians. I want to ask you, as a pioneer in starting the Laboratory Professionals Week at the whole laboratory scenario in India. How did you start it? And it's been a great success, and I want to hear from you, how did you start it and what were the difficulties you faced and what were your achievements with that?
Oh, okay. So the history goes back to 2004 when myself and three of the laboratory professionals thought that why can't we have a CAT program exclusively for the laboratory technicians itself. It sparked from the idea that there was global celebration of clinical laboratory professionals from the American Society of Clinical Pathology. So we thought that we will take the help of the vendors. So we took the help of few of the vendors in India who were gracious to say that yes, we can start across. And I started first in Chennai, which is now previously known as Madras. So we had about overwhelming response, about 150 people participating. So later on, in every year, we started improvising it, inculcating the vendors, and I wanted this to be a pan-India movement. It's not only a sole movement for an organization. We wanted the lab technicians to come onto the dais and talk across the cases, present what they have found, because we learned quite a lot from them. But we don't have any stage where we can recognize them and we can appreciation them. And we started having some cases. Something on quiz. So that's how it started. So today I'm very happy that DHEE Hospitals have taken up a DHEE stride. I want to say this again, DHEE Hospitals has taken the DHEE stride to bring across this environment to call the Bangalorean groups of the lab technicians to here. And I can see that there are 100 plus registrations here, and thanks to the management of the DHEE Hospital, Dr. Director of the laboratory, Dr. Chaitra K. So thank you so much for giving the opportunity to be with you. Thank you.
Sir, I just also want to ask you, we all know that you are like pioneer in a lot of things in laboratory medicine. Apart from this, what is Dr. Srinivas?
It's a very interesting question. It's the first time I'm getting from a laboratory like you. I'm a passionate traveler. So I love to travel places and I'm also a foodie. And I love cooking and I do cooking quite a lot at my home, and also people who call me to cook and like that. I do that. And of course, I'm a very adherent fan of society, which I really enjoy. The minuscules of the philosophy for day-to-day life, how it has been given to us. I think that is getting applied even in my life and career, and I do tell some of the tidbits in my sessions. So that's what Srinivas is. And the most important thing for me at this place where I have completed about 3 decades in laboratory medicine, I want my junior people to continue their legacies and go beyond and to establish that lab medicine as a career and take a stride not only to be working in silos but also as a combined integrated diagnostics. That's my mission.
So your one sentence, one word advice to youngsters in laboratory medicine today, both in laboratory medicine as well as in their life, what would that be?
I think I can put an acronym there. We can say PhD.
Okay.
So what do you mean by PhD? One should have a passion and one should have a hunger to the knowledge and also be disciplined. Because if you are not being disciplined, so you're not going to bring the culture of discipline in the environment. So my one takeaway message for any pathologists, microbiologists, clinical chemists or biomedical scientists is that inculcate PhD in your life and you shine in that. It's passion, hunger and discipline.
Thank you so much, sir.
Thank you so much.
Thank you.